Started.
Okay, welcome everyone. This is the meeting of the Macomb County Community Mental Health, the full board meeting. And I'm going to turn this over to Dave right now, just momentarily for a few housekeeping messages.
Thank you, Kathy. This is our first remote board meeting. Currently, everybody's logged in. I do have somebody else joining that says Galaxy S9. We do ask that non-board members not speak. I will try to keep people muted until we get to the public comment section, in which time you'll have the typical 5 minutes. We are recording this. And other than that, please pardon any other procedural things as we make our way through this first time. Thank you.
Okay, let's begin with our agenda. And I would like to start with reading the mission statement. And that is, our Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. And then next is adoption of the agenda. And I would like to move item 8B to immediately following the adoption, the item 3A.
I'm sorry?
I would like to move item 8B, which is the amended rules allowing the board to meet like this. I would like to move that to item 2A. I'm sorry.
Linda Bush, so moved.
Support, Lori Phillips.
Motion by Bush, support by Phillips. Any questions or comments on the agenda? All in favor signify by saying aye.
Aye.
Opposed? Right, the motion carries. The agenda is adopted, and we'll continue using voice votes as practical. So next would be our item 3A, which you'll find on the second page of the agenda, and that's to receive and file the state of emergency policy 5-013. And that's a motion that all the board members have seen before. We approved this under the guidelines established by Corporation Council, and that is to allow us to use distance means to hold our meetings.
Motion to support.
Second.
Second.
Any questions or comments on that? All in favor signify by saying aye.
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 Motion carries. Dave or someone, Chris O'Connell is trying to get into the meeting. I think he's using the former password that we had.
Oh,
Did somebody send him a message?
I will.
All right. All right. Next is item number 4, and that is a hearing. That's the hearing of the public. Is there anyone from the public that would like to address this board? Should be a function there that says raise hand. If you could click on raise hand. Does anyone want to address this board from the public? Anyone from the public? Seeing none, we'll move on. There'll be another opportunity at the end of the meeting, so if you just somehow missed the conclusion, you can speak again. Next is the minutes, approval of the minutes of our regular board meeting that was held on February 26th of 2020.
So moved.
Support, Selena.
Motion by Sarah Material, supported by
Selena.
Selena. Any questions or comments on the minutes? Hearing none, all in favor signify by saying aye.
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 Opposed? The minutes have been approved. Next is the minutes, approval of the standing committee meeting minutes of the program and budget meeting that was held on March 11 of 2020.
Move to approve Kraft.
Motion by
Support
Kraft,
Bush.
support by Bush. Any questions or comments on that? All in favor signify by saying aye.
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 Opposed? Those minutes are passed. Next is item number 7, which is the
Kathy,
report.
before you go forward, just to remind Dave and the secretaries who created the agenda, I sent this in to Sandy and Dave already, but our Legislative Policy Committee met in February. It didn't make the February agenda, didn't make March agenda. I assume that's what the change in secretaries that got lost in the process. There's a motion there as well. I want to add it now because people should be able to read the motion, and things are kind of at a standstill at the legislature for the same reason they are everywhere. But I would ask Dave to remind them to make sure we put it on for the next meeting,
Will do.
next full board meeting.
Okay, you're not asking it on this agenda, but the next full board agenda meeting.
No, that's fine. Next full, I mean, we're 1 month. It should have been on the last full board. I had talked to Lynn about making sure it was on this, but then she left. So next full board is fine.
Okay, thank you. So noted. Now, next item is item number 7, and there's items A through K have been discussed in detail at our program and budget meeting.
Move to approve, sorry, Megan Burke, move to approve 7A through K.
Support.
Who supported that?
I have a question about item
Phillips.
out of state.
Just wait, we need a, who approved, supported it?
Phillips, Lori Phillips.
Thank you. Burke, motion, support by Phillips. Any questions? Nick, you have a question?
My only question is, L, on the written agenda, there was an L. I can't scroll down here to see where it is on the current agenda. For some reason, the machine doesn't let me do that.
I have paper, Nick. What are you talking about? I'll look at it.
Well, on the paper one, there's an L to approve the invoice pertaining to the CARF survey. I don't know if we're doing that under invoices or under vouchers or.
No, the motion was items A through K, so we're gonna,
Right.
we'll do, I kept L separate.
You want to do L separate, then, thank you.
All right, any questions or comments on items A through K?
I have a question regarding
Brian?
the out-of-state travel. Given the state of emergency, is that still happening, or is there an update? Do you have an update on that?
Oh, yes. And Stacy's on the line here. That was canceled. They're giving us vouchers for future meetings. It was the same, the board approved my attendance at the National Council in April, out of state. That's been canceled. I actually canceled it ahead of that. But I took their voucher for a future conference. So yeah, we are not traveling out of state right now. Stacy, did you have any comment? Hang on, I have to make sure she's unmuted.
Need
Sorry
Tracy?
about that. I was able to get the refund on the train ticket as well.
Oh, thank you. So you took the refund?
She's on mute again.
Yeah.
And Lori, did you have a question?
No, I'm sorry, I didn't.
All right, thank you, Ryan, for that question. Good call there. Anyone else? All right, all in favor of approving items 7A through K, signify by saying aye.
Aye.
Opposed? Those items pass. Next is item 7L, and that's the request to approve payment for the invoice pertaining to the upcoming 2019 CARF survey. This item was waived by program and budget share to the full board meeting.
Move to approve, Bush.
This makes a motion to approve,
Support Megan Burke.
support by Burke. Any questions or discussion? All right, seeing none, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is item number 9, resolutions. Are there any resolutions on this to be addressed? No, none. Next is the voucher listing. Need a motion to pay the bills?
So
Motion to
moved,
pay the
Burke.
bills.
Support Fantuzzi.
All right, next is the Bush or Burke?
I think it was all of us.
Okay, very good. All right, any questions on any of the invoices or vouchers? Seeing none, all in favor signify by saying aye.
Aye.
Opposed? All right, next is the management report. And I'm going to ask Dave to do that, but it might be helpful just to mute us off for a little bit and then we can raise our hands to comment, just so we don't have talking over top of each other. Dave?
All right. Good evening, everybody. I could talk for a long time about the coronavirus. We had our first county employee test positive. He is a therapist at our first Southeast clinic, I'm sorry, in St. Clair Shores. He did work 2 days, and everybody who worked with him or that he saw for therapy have been notified. As a result, we did close the first Southeast site. We notified everybody. There was some folks scheduled to receive injections at that site. They were moved to our first Resources North site. We were able to get a tent set up outside of the first North site, which, as a reminder, we share with MyCare, the FQHC. So people who are having medical problems and symptoms are showing up there as well. They're working with us with the tents to screen people before they enter the building. So we are taking temperatures and asking people the CDC questions. And then only people who need a face-to-face service are going into the building right now. We can do, thanks to the state of Michigan, most services remotely now. And they have freed that up to where it can be over the telephone, Skype, FaceTime, Zoom, like we're using now. They have dropped a lot of the privacy rules related to that made it more difficult to provide those services. So if somebody shows up now, we can have them sit in their car in the parking lot and do their intake over the phone. We have stopped the face-to-face crisis screenings because nobody wants us in their emergency rooms, and honestly, the staff don't want to be in the emergency rooms right now either. There is an exception right now, and that's our children's crisis screening. So if a parent calls and the child's in the family home, they are being asked the CDC screening questions to see if anybody in the home has any symptoms. And then, of course, it's up to the worker, but we will go out and screen the child in the parent's home, because truthfully, we do want to try to keep everybody out of the emergency rooms as much as possible. So we continue to do that with every precaution that we have. We have the same issue as everybody else nationally with the protective gear. I was on the phone just earlier, within the last 2 hours, with Dr. Serpa. She has found some locations that she's able to purchase gowns and goggles and some masks from. So we're making sure that staff are as protected as possible. It was Monday, we had everybody working remotely as much as possible. We do have skeleton crews of essential staff at our administrative office, at the Garfield office, and the other locations. TJ Laporte, who you guys probably know, is doing a really good job. He's already contacted the cleaning crew. They are using appropriate cleaning materials, but they're going to beef that up and do a wipe down, an intensive wipe down of all of our buildings, starting with the administrative offices, I believe tomorrow. Right after we had the therapist test positive, we do have staff that are at home under self-quarantine. One of the staff at the clubhouse, Crossroads Clubhouse, did test positive as well. The clubhouse had already been shut down, along with our skill building and any of those congregate sites. So the impact, the spread of that was a lot less than at the first Southeast site. We met to plan about what's going to happen when it hits our residential sites, and that very afternoon, it hit one of our residential sites. So we do have a report that somebody who was living in his own apartment with community living supports is in the hospital, and according to his mother, has tested positive. We had a phone call this afternoon at 3 o'clock with the health department, who's been working with us very closely, with that provider, with the Provider Alliance, because I was very concerned about, it took like 9 staff off the schedule who now have to go into self-quarantine. The provider is one of our larger providers. She's able to cover the needs of the folks that are in this apartment complex with fewer staff. They will be making telephone contacts. If it gets worse, she has regional staff available to her, and ultimately she said there was herself. We are following up with all of our providers. I've learned that in our SUD residential sites, they have TB protocols, and we're going to be sharing those as samples with our residential staff about how to deal with infectious disease protocols, along with other information. Our staff are getting daily updates. Tracy Smith has started a LinkedIn site for our staff where we can actually share some things a little bit more on the lighter side about working from home and working remotely. Oh, Tony is waiting. All right, Tony just joined us. We are posting things to our website, working with Cynthia closely, trying to make sure that people know that we are here and available to the community. That's a really short synopsis of everything. Oh, twice a week, there's check-ins with the leadership from the county. Twice a week, there's check-ins with the Behavioral Health Developmental Disabilities Administration. They are at the state level working on an Appendix K. And I can hear somebody, hang on. That's a little better. They are freeing up a lot of the requirements right now to give us a greater flexibility to handle this crisis. They talked, I do not have it in writing yet, about an increase for the direct care staff during this period of crisis, which would be about a $2 an hour increase. I've notified providers that they can alert us if they're having financial problems and that we will work with them to try to keep them whole through this. And I'll be doing that in tandem with Richard Carpenter. And any other, if they're experiencing problems. So the staff that are not going out on site anymore are doing telephone checks on our providers, on the adult foster care homes and all of the other provider sites to check in to see how they're holding up so that we're aware of the issues as quickly as possible. So it's turned into its full-time coronavirus 24/7. On the funding side, the department, we had a meeting with Milliman, the actuarial firm. They stated openly that they had underfunded the system statewide by $120 million, and they were going to correct that for April through September in our Medicaid capitation rates. Today on the phone call, they said or yesterday, I'm sorry, on the phone call, they're going to make that total correction in the month of April. They've said that our revenue will not be impacted by the changes in utilization. So we'll be doing okay, and we'll be able to therefore help the providers out. I can't thank the staff of Macomb CMH enough. It's an amazing time to work through right now. The staff have been amazing. The state has been very supportive. The county has been very supportive. And we're making up a lot of this as we go, but we are tracking it and documenting it. So in case it ever happens again, we'll have a detailed playbook. So with that, I'll answer any questions.
All right, thank you. And hopefully there'll be a nice playbook that will sit on the shelf and collect dust.
That would be wonderful.
I see that Nick has his hand raised. If the rest of you, anyone else wants to speak, please indicate the raised hand. Click on that. And if you can't figure that out, literally raise your hand. I'll try to scroll through and look at all of you. Nick?
Yeah, Dave, first off, I want to agree with you and thank you. I think the staff and the county have done a tremendous job of taking care of our employees in light of the current crisis. You mentioned the employee who tested positive at Southeast, and that we followed up with any staff that he's had contact with. Are we following up, or is the health department handling any clients or consumers that he may have been in close contact with?
We followed up with our health department and did contact everybody that he had been in contact with. He actually lives in Oakland County, So the Oakland County Health Department is involved as well, and we're working closely with them.
So we're coordinating across the board. Other than the one case you talked about in terms of the CLS client, have we had any problems yet or reports of problems yet from the group homes?
No,
That's good.
knock on wood. I haven't. I'm afraid to look at my email right now because
Yeah, I know. That's really scary because, as you know, staff, because of the low wages, often work more than one, so they go from place to place carrying it. And once it comes, if you've got 4 or 6 people in a group home, odds are that it's going to spread within that group home. So it's good news to hear that it hasn't happened yet, and I appreciate the fact that you've been on top of notifying all of our contractors on the need to wash their hands and wipe down and try to avoid those things from happening. So kudos there. Thank you, David.
thank you. Dr. Serpa has been doing frequent updates to our staff and our providers. Tracy Smith has been coordinating the messages out to all of our staff, and Christina Mozella is the point to get the message out to on the provider side. So we do have a structure internally to focus on communication, but it changes frequently.
Well, we're
This is
also-
Linda. This is Linda, and I don't have a hand. I had asked Glory Valuate to send to the CAC Dr. Sherpa's emails too, and they were very thankful.
Yes, and we've canceled those meetings for the near future. We're doing everything
Right.
through Zoom now, or emails, and
Thank you. Is there anyone else that would like to make a comment or question? Nick?
Yeah, I had one other thing, David. I noticed that Richard is not on our list of participants. We were expecting a financial report since we haven't had one in 5 months and we really need to get one. Can you give us an update of where we're going to be on getting one? Are you going to deliver it by email?
yeah, I can do an email one. What we're planning is a board study session, more than one of those. Richard plans to do a funding explanation to begin with, and then build on that. And then the second part, we'll be talking about the information that's typically presented to a board of directors, and you guys will be able to provide input about the level of detail, the format, and all of those. They are working remotely as well. But yes, we'll be able to get that information over to you electronically.
And you anticipate then a board study session in the near future? We're going to do that by Zoom as well?
Yes, it will be by Zoom. Sandy's working with me to set that up.
Okay. Thank you.
Yep.
Lori?
Yeah, thank you. Dave, one of the other questions is I was thinking, or other people are asking me also, and I wonder, are you allowing for some of the CLS hours to be done remotely in a way, depending on what their plan of service is? If it relates to like safety issues and all this, being able to do that instead of being on a face-to-face in the home, are you allowing that to be done like kind of remotely too, to go over some of those goals that can be done?
Not yet.
Okay.
That's not, well, the state has put out a code list, and they've said what can be done remotely and what has to be done face to face.
Okay.
And they have not made that change yet. I've heard from, I think you're about the third one today to reference that. And I'll be drafting an email to the department asking for their consideration for that under certain circumstances. But as of today, that's not permitted at the state level. In talking to the provider today who's supporting people in the apartment, she will be doing some telephone check-ins. And what I told her was, please document all of those indirect services that she's doing to support people. And we'll look at that when we look at on the financial side. So we will take those things into consideration. There's just no formal reporting mechanism yet.
Right.
I sent out the general fund changes. So through April, we're keeping, we've opened up and are very flexible on the benefit side. Again, we want to reduce as many barriers as possible for people. And I don't know, I've done more directives in the last 3 weeks than in the whole last year. So we're trying.
All right, thank you, Dave.
Kathy, can you see the bottom of the agenda?
Nope, all I see on the actual, what we're looking at is 7D at the bottom of the agenda. Is that maybe?
That's all that's on the screen.
Just scroll down a little bit.
I am scrolling. I don't know why it's not.
It's not scrolling.
Oh, hang on. My screen sharing is paused.
While he's doing that, does anyone else from the board want to ask a question of Dave?
I got one.
Yes, Megan.
Actually, I didn't, it's not really a question, but I just wanted to thank everybody, especially Dave, your staff, for setting up the board meeting like this. You know, I work in a township setting, and I know I've been kind of like looking to my peers for this because it's really unprecedented doing everything like this. But you did this so quickly. You set up the whole Zoom thing so quickly. I actually feel like this is a really good model for other organizations that are in our situation. So just thank everybody, Dave, your staff, all the other board members, because this has been wonderful. Like, it's working perfectly, exactly how it's supposed to. Good job.
Thank you. And thank you, Nick. I saw the thumbs up.
That's great.
I did the screen sharing again and I scrolled down.
Yeah, that's right. It's working.
Okay, cool.
At least it is on mine.
Oh, great. I can't get rid of my thumbs up.
Just click on the thumbs up on your picture.
Oh, all right. Now, next then on our agenda is any other possible agenda items. So is there anyone else that would like to speak? From the board, any other agenda items that we need to consider? All right, seeing none, we will move on to hearing of the public again. Is there anyone from the public that would like to address this board? Anyone from the public? Anyone from the public? This is our last call. Neither seeing nor hearing anyone indicating they wanted to speak, we will go to item number 14, which is adjournment. A motion to adjourn is in order.
So moved.
All right. All in favor signify by saying aye.
Hi.
This meeting is adjourned. Thank you, everyone. I think this worked quite well, and thank you to everyone that participated and made this all happen.
Thank you all very much.
Thank you.
Thank you.
Thank you, Dave.
So.
Stay safe, everybody.
Yes.
Just remember, check on your seniors, right, Linda?
Yes, check on your seniors. And Lori's been checking on the elderly. Bye.
This worked out great, Kathy. Thanks.
All right. Good night, everybody.
Good night.
Good night.